Hey guys, welcome back to Medical Coding with Blue. Happy Monday! So it's Answer Monday, and I know it's supposed to be Countdown Monday too, but I forgot to do the countdown days, so we're just gonna throw it on to Q&A Tuesday, okay? But anyway, so I hope you guys were able to see what I was talking about when it came to having to look under different terms in order to find your diagnosis. I did that on purpose. As always, I have a purpose behind what I'm doing. So I did it on purpose so this way you guys can start getting used to having to do things like that. Because this is going to come up quite often when you are a medical coder. And another thing that I want to talk about today too is the fact that when I first started, I had a problem with congenital conditions versus acquired conditions. So, and you're going to see in our questions today that when sometimes when you're looking stuff up, it's going to give you a congenital code. So the only time you should be really looking at congenital codes is if obviously it is a congenital condition or it is documented as such. So this way you know you're going to be on the right path. And in ICD-10, the congenital conditions fall under the Q codes. So if you know you're trying to look up a condition and it starts with a Q, you know that you're on the right path. Okay? So let's get started with today's answers. So number one was agenesis gallbladder. I got Q44.0 because this is a congenital condition. Agenesis, when you look it up, it says congenital. So, but like I said, watch out for these congenital conditions versus acquired conditions. But anytime you see the word agenesis, they're talking about a congenital condition. Okay? And this is where you have to make sure if you don't understand a word, look it up. Google or any other search engine is going to be your best friend. Okay, so that was that one. Number two is BPH with urinary frequency and weak urinary stream. So this is where knowing your anatomy, knowing your medical terminology, these things are going to come into play. Because when you're looking this up in the index, and we got to talk about this first, you can't find it under benign, prostate, or hypertrophy. If you look it up under hypertrophy, it's going to give you a Q code. For prostate, it's going to say congenital Q55.4. Clearly, we weren't looking for that. We were looking for enlargement. So it tells you right here in the book, see enlargement, enlarged prostate. So I flipped to enlargement, and that's when I was able to find the BPH. So it'll say with lower urinary tract symptoms, or it'll say LUTS, okay? It'll say BPH with LUTS and BPH without, okay? So we know that urinary frequency and weak urinary stream are symptoms of the lower urinary tract system. So when you flip to that section in the tabular, it tells you there's a huge list, or it's a good-sized list, of lower urinary tract symptoms. And obviously, urinary frequency and weak urinary stream are both on these. So you know that you're going to code those together. It says to code additional codes. So what I got was N, like Nancy, 40.1 for the BPH with lower urinary tract symptoms. And then I got R35.0 for the urinary frequency and R39.12 for the weak urinary stream. Okay, so I know it seems like it's like, well, I thought we weren't supposed to code the symptoms. Only when it's specifically guided in the book are you going to code the symptoms when you have a definitive diagnosis. This is a perfect example of making sure that there's further detail when you're talking about BPH, okay? We know that this BPH has urinary frequency and weak urinary stream. That's what they suffer from the most. Okay, so, you know, the provider's going to know what to do from there. Same thing when we had last time with the, gosh, we had that other one with the, I can't think of the name of it right it escapes me, but it was on a couple of Q&As ago. So, not Q&As, but quiz Fridays ago. Yes, I'll have to think of it. So moving right along, number 3 is tobacco cessation counseling with a person who is a dependent daily cigarette smoker. So I got Z71.6 for the tobacco cessation counseling. And then when you flip to the tabular, it's going to tell you to use an additional code to identify what dependence it is, what tobacco dependence they are, whether they are for chewing tobacco or cigarettes. And so with that in mind, I got F17210. So those were the 2 codes for that one. Okay. Number 4 is Whit's anemia. I got D50.8. Again, very straightforward. Not anything out of the ordinary. So, number 5. Okay. Diabetes type 2 with CKD stage 3 with hypertension and coronary artery disease on long-term use insulin with dialysis. Okay. So I got the E11.22, and that says diabetes type 2 with diabetes mellitus, chronic kidney disease. I12.9 for the hypertension, chronic kidney disease, stages 1 to 4. N18.3 for CKD stage 3. I25.10 for the coronary artery disease, Z79.4 for the insulin, and Z99.2 for the dialysis. So just make sure that when you're looking at those, I mean, those, I'm going to keep throwing those at you because I think the sharper and the quicker you get with those, the more better off you are. And you want to be sure to remember to get as detailed as you possibly can when it comes to anything having to deal with chronic kidney disease, hypertension, diabetes, heart disease. You want to make sure that you're always going to be sharp on those, because that's where you have to be on point, Just some advice from me to you, just to make it a little bit easier when you get out into the real world. So, next, we have a homeless person. Number 6 was Z59.0. Very straightforward. Not a whole lot of discussion here. I mean, just homelessness. It just came up as homelessness. So, and that's all I got. Okay. Number 7 is recurrent tonsillitis. J03.91, and this is easy to find under tonsillitis, and then you see recurrent. Boom. Okay. Number 8 is arterial venous insufficiency, I99.8. So in this case, insufficiency is your action word. Okay, you're not going to start off with arterial venous. You're going to start off with insufficiency because that's where your action is, and then when you scroll down, you'll see arterial venous. So, okay, and that was the answer for that one. Number 9 is emotional instability. I got F60.3. Okay, so I want to talk about these F codes real quick. So anytime you have a patient who has an F code, anything from the F code series, those are all your mental conditions. You want to make sure that it is documented properly. You do not want to be picking up anxiety for a patient who has not been properly diagnosed with anxiety. Maybe they have anxious symptoms, but if they do not have anxiety specifically diagnosed, then you cannot pick up a mental disease, a definitive mental disease. You have to either look at the documentation again or query the provider to make sure, hey, is this patient diagnosed with this condition, or is this just a temporary thing, or is this just symptoms of? So when you're working with symptoms, there is a whole list of symptoms that you can go through. for any kind of mental illness. They have nervousness, they have irritability, and they have things like that. But when it comes to your mental health diagnoses, you have to be very careful. With any diagnosis, whether it is a chronic condition like hypertension, because sometimes people will say, well, not people, sometimes it'll be documented as patient is hypertensive, but they're not exactly diagnosed with hypertension. They're just hypertensive at the moment. Maybe their blood pressure was high because they had like white coat, or maybe they were running and they came in and they got their blood pressure and they were hypertensive at that moment. So you never want to just see something and just take it for granted that that's exactly what it is. No, in that case with the blood pressure, it would be like elevated blood pressure reading. Okay, so just make sure that when you have anything to do with these mental health diagnoses, that you're paying attention. Is this patient diagnosed with this? Is this just a symptom? Those are what the things that you want to be paying attention to, because these diagnoses follow these patients around, and you want to make sure that you're looking at the detail and paying attention, because that can affect that patient. I'm just letting you guys know. So just be sure to pay attention to that. And there's coding clinics out there about being certain when you are coding for a mental health diagnosis. Okay, so just something to think about. Okay. And then the last one is number 10, cancel procedure due to smoking. I got Z53.01. And that's it. Okay. I was just asking about the cancel procedure due to smoking just for that one code. So in this question. So that was it. So how do you think you guys did this time? And was this too hard? Was it not hard enough? Do you want something more challenging? Because I think that because I always try to look at diagnoses that I think would trigger something to remember. Obviously, like the F codes and the congenital Q codes, those are things to always kind of look for. Naturally, I'm always going to throw diabetes and hypertension and chronic kidney disease at you guys, because I want you guys to get used to those, particularly coding those, because the better you get at those and the sharper you get at them, the more easier it'll be for you. Okay, I'm pretty sure I'll throw in some heart disease next time. So, but if you have a particular specialty that you would like, I'm already working on the quiz Friday edition for this week. So, if you want a particular specialty, let me know. There's also still time to submit questions if you have any questions for Q&A Tuesday, and I will be working on that episode tomorrow. But I did get so many wonderful emails this weekend, and I want to thank you guys so much who sent me emails. I was like, oh my gosh. But I really like hearing from you guys. I like knowing what's on your mind. I like the fact that you're asking questions. This is the best time for you guys to learn is in the beginning, so I have a great show lined up for Q&A Tuesday. I have so many questions already, but if you want, please submit more questions. I will take all the questions you got, and maybe one will be its own episode. So, but yeah, that's all I got for today. So, I hope you guys had a great weekend, and I watched A Star is Born this weekend. I think I'm probably the last person to see it, but it was a good movie. If you haven't seen it, I'm telling you, it's such a good movie, and I love the soundtrack. I was like, oh my god. But that's just me. So, but anyway, I loved the movie. The movie was freaking awesome. So, but I hope you all have a great week, and I hope you'll join me tomorrow for Q&A Tuesday. If you are a medical coding student, a medical coder, a physician, a provider of some kind, a nurse, or just somebody curious about the fascinating world of medical coding, I hope that you will like and subscribe, and I will see y'all on the next episode. Bye!